What if I told you that the medicine sitting in your cabinet right now, the one your doctor gave you to help you stay healthy, might actually be working against your sex life, and you may not even realize it? I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to discuss 5 very common medications that new research suggests could be contributing to erectile dysfunction in millions of men. But here's the surprising part. Number 3 on our list is something more than 100 million Americans take every single day. So in this video, we'll explain why medications can lead to erectile dysfunction and give you a clear plan on what you can do if you're taking them, because you shouldn't have to pick between your overall health and your sex life. Now, before we go through the list of medications, it's important to understand that erections depend on a complex process. They require healthy blood flow, balanced hormones, and properly functioning nerves, and each of these can be affected in different ways. During a normal erection, you might see, hear, or feel something that arouses you, and your brain sends signals that tell the blood vessels in your penis to relax, allowing blood to flow in, become trapped, and just like that, you have an erection. But here's where medications can interfere. Most drugs can disrupt this process in 3 main ways. First, they can affect your cardiovascular system by limiting blood flow to the penis. It's like trying to fill a balloon using a garden hose that's bent. It simply won't work well. Second, some medications interfere with your nervous system, interrupting the signals between your brain and your penis. And third, certain drugs can change your hormone levels, like testosterone, which plays a key role in sexual desire. And if the desire isn't there, achieving an erection becomes much harder. Many of you watching are likely already taking a prescription medication. In fact, it's estimated that about 60% of men in the United States have taken at least one prescription drug in the past 30 days, and around 20%, or 1 in 5, take 5 different medications. Now let's look at the study. This research analyzed data from the NHANES database, focusing on 3,000 men who were using prescription medications, and found they were 80% more likely to experience erectile dysfunction compared to men who weren't taking any medications. Even after accounting for factors like education, body weight, other health conditions such as diabetes, high blood pressure, and smoking, the results still held true. And importantly, the researchers didn't just find a simple connection. They used a sophisticated genetic method known as Mendelian randomization analysis, which helps move that connection closer to actual cause and effect. In simple terms, these medications aren't just linked to erectile dysfunction, they may actually be responsible for it. So now, let's count down the 5 most common offenders. And I promise, at least one of these will catch you off guard. Number 5 is atenolol. These drugs are very effective at lowering blood pressure and protecting the heart. But here's the issue. Atenolol works by slowing down your body's sympathetic nervous system, which helps reduce both heart rate and blood pressure. However, that same effect can make it more difficult for the blood vessels in the penis to relax and expand. And since proper blood flow is essential for an erection, this medication can get in the way of that process. The irony with many of these drugs is that you take them to improve your heart health or overall well-being, yet they can create problems with erections. In fact, about 25% of men taking beta blockers report some level of erectile dysfunction. Number 4 was surprising even to me. Simvastatin, a cholesterol-lowering statin. Statins are some of the most commonly prescribed medications worldwide. If you're new here, it's important to know that high cholesterol itself is a common cause of erectile dysfunction. These medications do a great job of reducing the risk of heart attacks and strokes, but in theory, they can interfere with testosterone production. Here's the reason. Cholesterol actually serves as a building block for testosterone. So, when cholesterol levels are significantly reduced, testosterone levels may drop as well, which can lead to lower sex drive and erection issues. That said, this is quite uncommon and usually happens only at higher doses. If you're concerned, it's better to have your testosterone levels checked rather than stopping your statin. Number 3. Aspirin. Yes, aspirin. This one surprised me too. We're talking about the regular over-the-counter aspirin that millions of people take daily. Research suggests that long-term aspirin use might contribute to erectile dysfunction, possibly because it interferes with nitric oxide, which, once again, plays a key role in triggering erections. Now, don't panic if you're taking daily aspirin. In many cases, the benefits of aspirin are much greater than the risks. But again, this is something you should discuss with your doctor. Don't stop taking it on your own. Number 2 is another statin, atorvastatin, which works in a similar way. It lowers cholesterol production and, as a result, may also influence testosterone levels. But keep in mind, controlling your cholesterol, heart disease, and high blood pressure is extremely important, not just for your overall health, but also for supporting healthy erectile function. Now, number 1 is metformin. Metformin is one of the most commonly used medications for type 2 diabetes. This one is a bit more complicated because diabetes itself is a major cause of erectile dysfunction. In fact, nearly 50% of men with diabetes experience it. However, research suggests that metformin may add to the risk because it can reduce vitamin B12 absorption, which may affect nerve function, something that's essential for a healthy sexual response. And it may also impact testosterone levels. Now, before you run to your medicine cabinet and throw everything away, take a moment to pause. That could be very dangerous and even life-threatening. Here's what you need to understand. The conditions these medications are treating, high blood pressure, high cholesterol, and diabetes, are far more harmful to your overall health and sexual function than the medications themselves. Uncontrolled diabetes can lead to permanent nerve damage and irreversible erectile dysfunction. Untreated high blood pressure increases the risk of stroke, and high cholesterol can result in heart attacks. These medications are truly helping to keep you alive. But here's what you can do. First, speak openly with your doctor. Be honest about any sexual side effects you're experiencing. There are often many alternatives available, and some medications may work just as well with fewer effects on your sex life. For example, ACE inhibitors may be an option instead of beta blockers, or a different type of statin might be considered for cholesterol. Second, and perhaps even more important, focus on improving your lifestyle. Regular exercise, a balanced diet, quality sleep, and managing stress all play a major role. I can't stress enough how important stress management is, especially today, when so many people are constantly under pressure. Working on these areas can greatly improve sexual function and may even reduce your need for medications over time. Third, if no suitable alternative is available, you might consider adjusting the timing of your medication or possibly lowering the dose, but only after discussing it with your doctor. And finally, don't ignore the issue. If you're experiencing sexual side effects, it's important to take them seriously. Erectile dysfunction can be an early warning sign, often appearing well before more serious heart problems. Many men with ED go on to develop cardiovascular issues later. Recognizing it early, talking with your doctor, and getting evaluated can put you on a better path forward. I can tell you from experience that many of my patients with erectile dysfunction become highly motivated to improve their health. This can be a powerful opportunity to make meaningful changes in your life, and I truly hope you take it.